Then you mentioned nattokinase
Yes. And psyllium husk.
Psyllium husk is also, look, that's an easy one. That's why fiber has also been talked about as good as heart healthy. There's a lot of reasons. Psyllium husk is a non-digestible fiber. So what it does, it's partially non-digestible. There is some that's digestible, but it helps your gut microbiome and it also absorbs some of the fat. So you're doing two things here. You're not absorbing as much of the fat that might be in your diet, and then you're providing a prebiotic. So it's something that helps feed the microbes in your gut the right way, helps improve gut health, that reduces inflammation, that has a direct impact on cardiovascular health.
But when you take that, you got to drink a lot of water.
Yes.
it plumps up, it gets gelled like a flax seed or chia seed. And then you're almost chewing this as you're trying to get it down. And I think the warning is, don't take just a little bit. You got to drink a lot of water because otherwise you just constipated or reverse. I don't know. I followed instructions, so everything was good for me. But
well, it's also great if you do that, and it's a filler too. So as it expands, it'll expand space in your stomach and reduce appetite too. And that way it can help with weight reduction and secondarily give you some cardiovascular benefits that way too.
One thing I'm thinking, because my husband cleans the cups after I drink this, and he's like, what in the world is this? It's stuck. It dries and then you can't get it off. I explained it to him. I'm taking this for my heart health. And he goes, but is it doing the same thing inside your body, like stuck? and it makes me question, is that what's happening inside the gut if it's sticking to my cup like that?
Yeah. Well, it might be that just it's getting rehydrated. It could be that's where it's sticking, where it needs that fluid like you were talking about. Ideally, if it's sticking to the side, it's a fiber, it's going to be eaten by the gut microbes. So hopefully you're pooping it out just like everything else.
I always imagine it. It must be sticking to the fats or the cholesterol, whatever. It's pulling it out because it's sticking. That's right. I don't know what it is, but that's one of my protocols.
Yeah, nattokinase is the natto. It's the fermented natto, basically. It's a growth that happens on fermented natto or soybeans type of product. Yeah. And it is an anticoagulant. And so what nattokinase does is it helps to recycle heparin, which is our natural anticoagulant. This is really interesting because it resides in the glycocalyx, that lining that's around the endothelium, that last lining that protects the endothelium, that slimy layer that's the protective coating that keeps things from sticking to our blood vessels. So there's a lot of stuff that resides in there. There's proteins, there's enzymes, and it also covers up the molecules that grab to the immune cells. So in that layer are also these anticoagulant molecules called heparin, and nattokinase helps our body regulate when those get released and when those get held onto. So if you have a blood clot, or we make blood clots that are microscopic all the time and then dissolve them. And so heparin is part of the molecule that dissolves those. And by taking nattokinase, we optimize the protein in the glycocalyx, maybe help its health and maintain a little bit of amplifying that ability to prevent clots from forming. When you think about, so there's many cardiologists believe, and they have a theory that part of the atherosclerotic process involves microscopic blood clots that aren't being controlled. And this is one of the theories of Lp(a). Lp(a) is not only a inflammatory compound, but it's a thrombotic compound. It prevents clot breakdown. So nattokinase theoretically can help that because it helps the body continue with the clot breakdown when it should.
I understand you need to take, I think, 10,000 FUs per day because I think the capsules are, I don't know, I think they're much lower dosage. So I think people who are doing this are not quite taking enough because there's some research study that shows that's what was the effective dose, but maybe everybody's different. So is that what if somebody wants to get on nattokinase, that's something to look at, right?
That's right. 10,800 was the exact dose. They're fibrinolytic units. When you say FUs, so you gotta qualify that.
10,000 FUs, yeah. So, okay, this is a supplement I think it's not difficult to get. I'm wondering how it would compare to natto. Because if I'm in Asia, I see natto on the menu or somewhere, I'm getting it. It's not something I can get all the time in Europe, but I wonder how it would compare to an actual natto. Or is it just that's why we have a supplement because you can't get enough? I don't know.
Well, it's not the actual natto. It's the fermented growth that comes on the natto. So getting natto itself won't necessarily do it. There's another compound that's similar. It's called lumbrokinase, and that's actually from earthworms, and it's got a higher fibrinolytic potency to it. Again, there's often the case with supplements. There's quality control. Are you getting raw bulk or are you getting concentrated forms? So it's harder to know what you're getting with lumbar kinase, and it's more focused to just fibrinolytic or clot breakdown. Nattokinase has a little bit of a wider function to it. I'm a big supporter of using aspirin as long as you don't have bleeding or bruising issues. In the elderly, it's something to be aware of. The bleeding complications are there. They're documented in many studies, and so we have to be a little careful as we get older using aspirin. But I do like it for its ability to inhibit clotting and as an anti-inflammatory. Aspirin, yeah.
So should people test something before they start taking aspirin, or do you think it's kind of everybody should be on this kind of a thing?
I think you could probably get away without doing a test. I mean, the test ends up being some sort of genetic-based testing, and there's not any one gene. It's more of a collection of SNPs. I think it's more about looking at risk factors. Do you have, and how you respond too, because some people, it's very clear, once we start aspirin, they bruise very easily, or they don't have, or even before I've started it, they have very fragile skin and they bruise. I'm going to be cautious about using it on them. So we can probably tell clinically, but in the right population, I think is very useful. It's also one of those things, aspirin, and you bring up fish oil, when you take the two of them combined, it helps our system make some really highly anti-inflammatory compounds. They're both anti-inflammatory on their own, but when used together, they amplify our ability to make what are called pro-resolving mediators. Mm-hmm. And these are higher potency anti-inflammatory compounds. Those are sold as a specific supplement, and you could take those, and you could also potentially just take a good fish oil and then a baby aspirin. And you don't even have to take baby aspirin every day. You could do it every other day or something like that. Because remember, the lifespan is long. It will stay in your system for a little longer than a day or two.
Do you have different patients with different profiles and you'd give more or less dosages of aspirin?
Yeah, I do. And it depends on if they're on other anticoagulants, if they're taking something like nattokinase, what are their other health conditions, if they have propensity for bleeding. I'll try and find a way to get it involved into their treatment. But if there's too much of an issue, then I won't. Okay,
so that's a warning. Don't just pick up aspirin and start taking it. Go ask your doctor, and all these supplements as well. This is not for everybody to do. Just, again, check with your doctor. And you mentioned the pro-resolving mediators, and I think they're also called SPMs as well. These are supplements that people generally buy. And you're saying, well, we'll just get a good fish oil and an aspirin, and you may have
that's right.
benefits, right?
Yeah, that's right, because they are derived from omega-3s, and omega-3s on their own have a really good anti-inflammatory capacity. Very helpful in so many ways. They help with balancing the omega-6s, because we have so much of that in the American diet for sure. So we need to balance that, even if they're coming from healthy sources. Most of the omega-6s come from processed foods, seed oils, and those are highly inflammatory. But even if you're getting them from natural sources like nuts and meats, if you're still getting an overload, you're going to make more, it's going to convert into compounds that may be inflammatory. So we still want to balance that with omega-3s. And so when you get those balanced, omega-3s will inhibit the omega-6s from becoming problematic, but they are themselves anti-inflammatory. So they'll help the system in that way, and they also are important for membrane health. So I'm a big supporter of omega-3s also. There's probably a place for most diets. It's just a matter of cycling them. I don't think any one thing is what we should be doing forever. It's important variety is important, and different ways to test our system. And also when it comes to supplements, when you're looking at proprietary blends, it's important to see what's in the formulation, because it may just have a tiny bit of an active ingredient, or it may be something that you're already taking somewhere else. A lot of times they're just glorified multivitamins with a sprinkle of something else, and they're calling it something that's heart healthy. So it really just means if you're going to step into this field and this way of treating your health, get a little granular and look at what you're taking. Don't just trust the claims.
Good advice.